My name's Ron Waldman. I'm a professor of global health at the Milken Institute School of Public Health at the George Washington University. I specialize in the safeguarding of health in humanitarian assistance and the provision of health services to the most marginalized and vulnerable people. I was in medical school in Switzerland, and when I was graduating, I couldn't stay in the country anymore, but I really didn't have anywhere to go. So at the time I was managing a baseball team. I was talking one day to my star pitcher, and he asked me what I was going to do, and I said, I have no idea. I'm going to be a doctor, but I don't have any plans. He said, oh, my girlfriend's father is a doctor. Maybe you can meet him and get some ideas. Her father was actually the director of the global smallpox eradication program at the World Health Organization. And he just asked me the first time I met him if I could go to Bangladesh to work on smallpox eradication, and if so, when could I leave? So I just said, sure, tomorrow. When I went out there, I met everybody from the Centers for Disease Control, as it was called at the time. So now I had a plan, which was to come back and join the CDC. So I think my particular field is really at a crossroads now. Today actually is the start of the first ever World Humanitarian Summit that's taking place in Istanbul. There's quite a lot of concern for the directions in which humanitarianism has gone over the last few decades, and more concern for the future. I happen to be the chairman of the board of directors of an organization called Doctors of the World USA, and we share those concerns. I think it's really been a field that has been based primarily on good intentions and not enough on research. Since our first papers appeared in the late 1980s, it's hard to say whether or not things have really appreciably improved. So hopefully some concrete action steps will come out of the World Humanitarian Summit, although there are many who feel that that's not necessarily going to be the case. A great student is one with an inquisitive mind. I do think that students should know what's available to them in terms of advancing their thinking on any particular subject. And I'm happy for those who come to see me or to seek advice, or they don't have to come to me, they can go anywhere, but I really want them to pursue their own interests in a way that will advance their own careers. I find DC to be an incredibly rich city. The restaurants are great, the parks are great, so I just really like DC. I'm from New York City, and people always ask me what I think about the difference, and I guess in this instance I do go along with those who say that New York's a great place to visit, but I wouldn't want to live there. I want to live here. I feel humanitarianism, it's about humanity. We all belong, you know. We're all members. It has to be of interest to everyone, and we've seen over the past decade, maybe a little bit more, just an incredible rise in threats, whether they be infectious diseases like Ebola or Zika or yellow fever, whether they be conflict in Syria and Yemen and Iraq, in the Central African Republic, and in so many other places around the world. I think we all have a stake in this, and in my field we need to make sure that people have access to even basic health services for themselves, for their children. This is what keeps them alive and gives them, hopefully, a way to move forward with their lives, to improve their circumstances. Question authority is advice that I would give. And that means not just political authority, but it means in the classroom as well. I like it when students are challenging. I like to have students in my classes with their laptops open, fact-checking things that I say. So I'm Ron Waldman. I'm a professor of global health here at the Milken Institute School of Public Health.